We're here now doing a technique that very few doctors do. When people have very severe scars, we sometimes need to remove the scars surgically. So here we are today on my patient who has been doing a combination of treatments with me. We're going to be doing a stronger laser as well, doing punch excisions. So we're now surgically removing some of these scars, and you guys can see around them we've done some TCA Cross, which is that chemical treatment we do in scars, perfect, to get them to scab in over on themselves. It's all the little white areas, you could show them. We are surgically now cutting some of these scars out to get him more improvement more quickly in his scars. We are going to be doing lasers. We have been doing laser treatments.
Let's show him his progress photos
But you
right
guys
here.
see, look, hold on. Yeah, show them progress, but then show them this. Right here, we're removing that scar and we're actually cutting it out. You guys can see now. Now go ahead and show them the improvements in the depth, and especially on the forehead. You can see forehead and the eye area, a really big improvement in the overall softening of those scars. And so now we're going to continue.
Was he put under for this? No, he's not.
No, he's local creams, topical creams, and also nerve blocks.
Because we are doing a big laser
local
after
injections.
this.
What's your computer? What's your computer? It's about to fall. So we are going to continue this, and then we'll add a little more topical for him. Go ahead and dab there. You guys see that we're literally closing these scars surgically, and this will allow us to get more blending when we do lasers. Each one of them requires different depths, so we have different ways in which we surgically remove them. But we're going one by one, and we're doing about 12 of them today. So it is what it is. We need to get some of these scars more quickly improved, and sometimes we need to surgically remove them.
As for doing punch transplants.
Punch elevation is an old technique that we used to use, where we would lift the scar and then re-stitch it in place. It never really did as good. Or dermal transplant is another option.
Are you doing dissolvable sutures?
No, these are not dissolvable. The ones we're doing here. Right now I'm putting permanent ones in that will remove in about a week.
People are saying you're their mentor, they're another doctor.
Oh, thank you guys, I appreciate it. We love what we do, that's why it's Saturday and we're here. We're trying to get as best improvements as we can.
Will this hurt afterwards?
No, not really. No, not really. He will be getting laser, so he may feel that a little bit. But in general, he shouldn't be having much pain from this treatment itself. And even though it seems like we're creating another scar,
Surgicalcaps.com.
it's a scar that we can easily treat.
So really appreciate what you do. Surgicalcaps.com shouted me out.
Love you guys. I love surgicalcaps.com.
Will he need antibiotic
yes.
prophylaxis?
Yes. Oh yeah, we're on all that. All the laser treatments require that. We're doing strong lasers. You need antibiotics. You need antivirals. You want training, you guys? Send an email to pj@jasonmrmd.com.
How I miss those days working with you at Mount Sinai.
Oh wow, who's that? Thank you.
Borik Princess.
Oh. Come see us.
Can I have observation in your clinic? I'm a German dermatologist.
Yep, email pj@jasonmrmd.com and we can set up training, guys.
Not possible to ask about mosaic surgery in this case.
Say that again?
There's no mosaic surgery.
Mosaic or Mohs? M-O-H-S?
M-O-S-A-I-C.
I don't know what that is. Not sure.
Will you ever come to the UK?
Probably not, guys. But you can come see me in Dubai. Close by.
JFK is super far.
Oh yeah, I was gonna say that is far. So we're closing some of these deep temporal scars, and we'll be lasering around them.
How can I apply to observe? You guys send an email to pj@jasonmrmd.com. If you didn't get that, send us a DM and we'll tell you where to email. When exactly are you in Dubai? It's on our feed. I think it's the 3rd and 4th of April.
It's on the feed. It's next week, guys. If you want to see me, gotta make an appointment now. So you guys see we're doing a lot of punches. And then we'll renumb for a little bit for his laser. But by doing this, it allows us to make it, it's easier for us to then do a laser. That's the thing.
For those of you new, let me show them the results that we have so far. This is our first treatment. We've done a few rounds so far. Here is the after. As you guys see, much softer. The scars, some of them are still there. They're not as deep. They're not as noticeable. So we have the before and the after. That is the same ring light we used for each one.
Sleeping.
Do you send supplies to Dubai, or do they have surgical equipment there for you?
Everything is there, guys. Everything I need is there. Otherwise, I wouldn't be going.
You guys know we travel with some of our equipment to New York. We're not able to travel with that stuff to Dubai.
A little too far to take a laser. You know? A little longer. So this is how comfortable he is. He's sleeping.
Some drugs.
That
That got me
okay.
on
Why
cloud
not?
9.
That's a good thing. Alright, turn this way. That's not a bad thing. So we're getting some of the in this more sensitive area. These are a little harder to remove. Remember, I was a Mohs surgeon, so it's important that if you're going to go see someone for scarring, especially see someone that knows anatomy, that has patience. This takes time.
So wants to know about what helps with chin wrinkles.
A lot of different things. We do Botox, we do lasers, we do filler. We have to see you to know.
Let's see. Someone asked about subcision, if that will help.
Unfortunately for him, really, he's not the best candidate. When he smiles, the majority of his scars come together. That's why today we're going to do a little sculptra. So if he was a candidate, we would do it. He's not the best candidate for it.
What do you do for red acne scars?
A lot of things. There's a lot of options for that. Actually, that's one of the easier things to treat. So my suggestion is consult with us. Tell him how.
So say, wow,
Try
the
not to touch,
strength
don't
of
touch, don't touch. We'll get you. If you're itchy, tell me. We'll get it.
so wow, the strength of precision needed to do this surgery.
Okay. Turn now
I have
left.
deep pores. I've tried many soaps. Nothing works.
Come see us, guys. Tell them how to make.
Guys.
That's easy to do a skincare consult.
Yeah,
for.
easy. Those are very easy. We can do those at emeragecosmetics.com, or you can send us a DM, full name, email, phone number. Someone's asking about fixing a bad hair transplant. Guys, we have great hair transplant surgeons we work with. Send us a DM, full name, email, phone number. We'll help you out. They're saying that PRP microneedling is helpful for scarring.
Not really.
Not
It's good for
in
skin texture.
not in severe cases.
We're almost there.
Recovery time from this?
Well, we're doing a CO2 resurfacing after this, you guys, so it'll be a week. But he's done multiple ones and he does really well. Within a few days, he can be back at the gym with some scabs.
Yes.
He takes good care of his skin, and we also know how to prevent hyperpigmentation on him.
Someone said, thank you, Dr. Emer, for the peptide referral.
Oh, you're welcome. It's the best doctor ever. And you're going to look amazing. Just follow the plan.
Can you erase the tummy tuck scar?
Yes.
Send us a DM. Full name, email, phone number. We'll take care of that.
For peptides, I would suggest the B100 vitamin. It enhances the peptides. It's on emeragecosmetics.com because I like it so much. Definitely get it.
There's by TCA burning hair follicles.
Does it burn hair follicles? No. Alright, we're almost done.
Is he asleep or numb? Maybe a combination of both.
Yes. So we're just going to do some fine tuning on this one.
Someone said, so you can erase a tummy tuck scar. Yes, we can, guys. Send us a DM, full name, email, phone number. Dr. Emer is the best with handling any kind of scars. Acne scars, surgical scars, you name it.
Scars are challenging. Take treatments, but we can do it. Okay, so that would do.
And then
And on the lower, I'm going to do start. This one's very good. Good. Alright, you guys take a look. They're all done. I did 12. All the little punches there completed. We removed them all. The stitches are in there and they'll come out in a week. So that's
Alright.
something for
Do you
you
wanna
guys
talk
to
about-
learn. What?
Want to talk about the results?
Yeah, if you guys take a look, I want you to see, look at the depth of these scars compared to how much softer they are. Now we're going to do a stronger laser today. Look at the scars up here on his forehead versus now significantly more improved. These deeper scars we just removed and some of these flatter, deep scars. Adding some sculpture to build volume here next and build collagen. That's going to help the scars as well. Let's stay tuned for the laser.
All right.
All right.